Well, the doctor forgot. He said, I sure hope he's not feeling any pain, as he was cutting into him. The guy brought himself out of trance right in the middle of the surgery. He said to the doctor, don't use that word. And he took himself right back into trance. That's a true story. So, one of the first rules of working with pain management and hypnosis is when you have a client in a trance state, use the word sensation rather than pain. Because sensation is a neutral word. Doesn't that make sense? You can talk about the pain in the interview. You can strategize in the interview how you're going to do pain management work, but when you're in trance, it's sensation. The next is a replacement or substitution of sensations or reinterpretation of pain. When I have worked with women to prepare for birthing using hypnosis, we will often come up with images that represent the cervix and the opening of the cervix as a part of the preparation for the delivery of the child. And women will come up with images of like flowers opening, or the cervix softening like a ball of cotton. So instead of having sharpness and harshness, there's a sense of fluidity in the changes that are going on in the body, and imaging those. And it's really helpful for the client to come up with their images, because it'll be germane to their own creativity. So instead of having a pounding headache, maybe it's a knocking to get your attention to take a break. You can reinterpret it, reframe it. And then there's a displacement or transference of sensation. And this is particularly useful when someone is dealing with psychosomatic pain, which means something energetically is creating it, whether it's a thought or a disruption in the energy system, that it's not diagnosed medically as a problem, but there's still pain there. And I get clients all the time who have chronic pain who say, doctors can't tell me what this is, but I'm in pain. Can you help me? And these techniques will usually help tremendously. So the displacement or transference of sensation story that I'll share with you was a gentleman who was finishing up his PhD in a university. He was almost 30 years old. His whole life and all of his adult life had been in academia. After he graduated with his PhD, he was going to have to go out in the world and get a job. And he wasn't too thrilled about that because he was used to being a student. He was really good at that part of his life. And he developed, during the time of finishing his thesis, paralysis in one of his hands, so he couldn't use the typewriter. His hand wouldn't work normally. And when we did hypnosis to talk to the hand said, I'm stopping you from graduating because you're terrified of going out into the world. He says, yeah, but I only have 6 months, and then if I don't get my dissertation done, they're not going to graduate me. I got to get this dissertation done, so stop this already. His hand said, if you will do some inner work to get ready, to get out in the world, to deal with your fears and anxiety, to work on your self-esteem, I will put this paralysis in your hand into your big toe of your opposite foot. And that's what happened. He had a numb big toe in his foot. Instead of a paralysis in his hand, he could finish his dissertation as long as he did what he agreed to do, which was to work on himself to get prepared to go out in the world. That was a psychosomatic problem, not physical. That's the mind-body connection, the capacity to affect matter with our mind. So he displaced it, he transferred it. Or there's dissociation or body distortions. What would happen if your broken arm that was aching was floating over in the corner over there so you could sleep? To dissociate it. To send your pain up in a big balloon out of the room. Using imagery like that. and time distortion. The time between contractions in labor can expand to feel like a vacation. You can luxuriate between those contractions and just expand your sense of time. And then when you have your contractions, you can diminish it, make it very quick. Because time is malleable in our consciousness. We all know that when we're having a good time, time goes quickly. When we're worried and anticipating, time slows down sometimes. So you can work with time distortions as part of it. Or systematic diminishing of sensations. You can tell the unconscious, with every breath that you take, the sensation in your head diminishes. Every time you blink your eyes, you release the discomfort from your head. So it's linked up with an activity that's systematic. I don't know how quickly your blinking eyes will diminish the sensation. That's really up to your unconscious to decide. But it has the capacity to release the sensation every time you blink. So you're setting in a suggestion that the unconscious can respond to any way it sees fit. This is one of Erickson's techniques he was renowned for. And then age regression. This is so helpful with so many different things that people come into session for. What would happen if you went back to a time before your car accident and remembered what it felt like to have a comfortable, strong ankle? If you can go back to your childhood and remember what it was like to be abandoned or spanked or lost, why can't you go back and remember positive things? Of course you can. So you can use regression to times when there was no pain. And then, of course, there's distraction techniques. I had some minor surgery by having some moles taken off years ago, and I went to the dermatologist for the pre-exam, and we had a decision about how we were going to do it, when we were going to do it, and I said, when you do this, I do not want any local anesthesia, I want to use hypnosis. And she looked at me like, you are crazy. She says, I'm not comfortable with that. I said, I know you may not be comfortable with it, but I'm a professional hypnotherapist. I'm very comfortable with this. I'd really like to do this. She said, but I'll make a deal with you. You can teach me about this, because I've never had this experience. I'll give you half the anesthetic that I normally use. I said, that's fine. We can do that. I'll just numb myself before you do it, so I won't even feel it. So we did it. The surgery went great. She told me when she was done, she said, you can come back now. I had taken myself on a hot air balloon trip over Napa during the whole thing. That's where I was. And I was absolutely comfortable, and she told me, I have never in my life worked with a patient who was as relaxed as you were and as still. I said, my card, madam? You might look into pain management, work with hypnosis. She never called me. But that's an example of distraction. I was sitting in the office, but I let myself go somewhere else. I engaged myself in another activity. And distraction is a normal way we try to deal with our pain. If any of you have been in Safeway shopping and the little kid who's hyperactive is running around and hits his head on the wall or something and he's having a temper tantrum and screaming in the middle of the aisle, and the mother says, let's go get some ice cream, Johnny. Let's get you some ice cream. You'll feel better in a minute. Ice cream does it. For some of us. So it's, again, a natural way to deal with pain is distraction. So pain is a mind, body, spirit issue. A symptom is a signal that there is dis-ease in the holistic organism. Pain is a messenger. It needs to be honored. Something is off, whether it's physical, psychological, spiritual, if it's an entity, if it's a past life filtering through, there's something that's screaming for help. And part of what is so phenomenal about hypnotherapy is when you get access to the unconscious, you can often find out what is in a state of dis-ease so the client can do something to help himself. The story I told you about the woman who had the chronic neck pain with EFT, who had the grief underneath it, the physiological pain was there, but it left as soon as she realized that she hadn't worked with her grief, shows the mind-body connection that can trigger a pain response. It's common for people to have non-diagnosed pain and for hypnosis to support people in releasing it. Cases in point, past life connections. A young man I worked with had chronic pain in his shoulder, sharp chronic pain. We did a regression back to the source of the pain. He was a Native American, shot in the shoulder by another Native American in a battle. They were supposed to be shooting the cowboys, somebody else, but he got shot. And it was that arrow energetically that was still in his body, so he psychically removed it and the pain went away. How many years of therapy, how many doctor appointments is it going to take before somebody like that's going to get relief? It's not going to work in those regular ways. It had to come through the unconscious. So pain can, you can work with pain in so many different ways with hypnosis. In the basic interview, there's some additional questions you want to ask a client who's coming in for pain management or who comes in with a physical problem. When did it begin? What was the event or trigger? What have you done to help yourself? What's worked? What hasn't worked? Have you seen a doctor or medical practitioner? And what is the diagnosis? That's going to give you a pretty good understanding of the person's experience of it. If they say they have not seen a doctor, you recommend that they see a doctor, talking about pain being a signal, that it would be irresponsible of me to teach you pain management techniques without you knowing what it is you're diminishing pain on. You can certainly do a first session, but if they're going to come back to do ongoing work, you would want them to see a doctor. Any questions so far or comments? Okay. So we're going to talk about secondary gains. This is a psychobabble term. Are all of you familiar with what secondary gains are? Do you know what that is, Dana? Okay. So here are some ways that secondary gains can come up. It's a way to manipulate people. You can think about your own life. You know any hypochondriacs? Yeah, it's a way to manipulate people. It's a way to get positive attention, sometimes. A way to avoid contact, to avoid things. A way. Huh?
Like if I don't want to show up for work, I get sick.
Yeah. If Johnny has a mean teacher and he doesn't want to go to school, he gets a tummy ache. It's a way to stay away.
But it's also a way where you say gives positive attention.
Negative attention.
Also, negative attention
Right.
is still attention.
That's true. That's true. But see, the unconscious thinks it's positive. Any way they get attention.
Exactly.
Any way they get attention is a good thing. A way to escape from deeper existential issues, like who am I, what am I doing here, what's my purpose? Just a way to avoid that. If you're sick all the time, you don't have to deal with that kind of level of consciousness. Financial advantages. Ooh, how many times have I had clients who've had car accidents who are in litigation? Help me with my pain, but don't take it away because I still have a court date. I can't be gone. Is that a double bind?
Yes.
But people say things like that.